Bismillahirrahmanirrahim. Today we are going to discuss hypoxia and oxygen therapy. As you are knowing कि जब भी ऑक्सीजन की कमी होती है तो उसकी ट्रीटमेंट ऑक्सीजन थेरापी होती है. I am Dr. Bux Kachiwal, Professor and Chairman of Department of Physiology and Biochemistry, Sindh Agriculture Institute, Tandojam. This lecture is also a component of a respiratory system. जो आपका रेस्पिरेटरी सिस्टम का चैप्टर है उसमें 2-3 हमने टॉपिक कवर नहीं कर पाए थे, तो उसमें एक टॉपिक हाइपोक्सिया एंड ऑक्सीजन थेरापी भी है. तो आज हम इसको ऑनलाइन कवर करते हैं और ये आपके पास पावर पॉइंट के सूरत में और लेक्चर के सूरत में, दोनों सूरत में आपके पास आपकी व्हाट्सएप पे और यूट्यूब पे और माइक्रोसॉफ्ट टीम में मौजूद होगा. तो let us discuss what's hypoxia and how we will treat that hypoxia by oxygen therapy. Hypoxia is an abnormally reduced oxygen supply to tissues. It's a pathological condition in which body as a whole that's known as a generalized hypoxia, or a region of the body having, and that's known as a regional hypoxia, is deprived of adequate oxygen supply. जब किसी भी हिस्से को या पूरी बॉडी को ऑक्सीजन जो बैलेंस रिक्वायर्ड है वो नहीं मिलती तो हाइपोक्सिया कॉज होता है. तो deficiency in either the delivery or the utilization of oxygen at the tissue level, leading to changes in functions, metabolism, and structure of cells and tissues of the body is known as a hypoxia. So by definition, hypoxia is a low level of oxygen at the tissue level. Hypoxemia means that low level of oxygen in blood. Partial pressure means the pressure exerted on the surface by the molecules of individual gases. The partial pressure of the oxygen can be calculated by given atmospheric pressure by multiplying the concentration of gas by the atmospheric or barometric pressure. अब हमारे पास जो अर्थ पे प्रेशर है वो 760 mmHg है और जो हमारे पास ऑक्सीजन परसेंटेज है, जो ऑक्सीजन इन गैसेस इन एयर जो अवेलेबल है वो 21% है. अगर आप 21% को 760 से मल्टीप्लाई करेंगे तो यू विल फाइंड द रिजल्ट ऑफ 160 mmHg. मोस्टली हमारे पास जो हम ऑक्सीजन इनहेल करते हैं that is being inhaled at the rate or a pressure of 150 mmHg or 160 mmHg. तो ऑक्सीजन जो है जब हम इनहेल करते हैं it goes to the tissues to be metabolized and to develop the energy in the body. तो ये जब एयर से लंग्स में और लंग्स से फिर आर्टरीज और फिर पल्स और जो हमारे वेजल्स हैं उसमें जाती है या कैपिलरीज में जाती है, उसके बाद टिश्यूज और फिर सेल्स में या माइटोकॉन्ड्रिया में इंटर होती है, तो इसका प्रेशर जो है होता जाता है. तो पार्शियल प्रेशर जो एयर में है मोस्टली इट इज 150 to 160 mmHg and it is being carried out into the lungs. और alveolar जो पार्शियल प्रेशर है वो है 100 to 110 mmHg. जब ये आर्टरीज में ऑक्सीजन कैरी होती है तो that has a 98 mmHg partial pressure, whereas when it reaches to the capillaries then it loses the partial pressure that reaches at a 50 to 80 mmHg. जब ये टिश्यूज में पहुंचती है ऑक्सीजन, तो ये जो पार्शियल प्रेशर है वो और रिड्यूस होता है और वहाँ पे 30 to 50 mmHg होता है। जब ये पार्शियल प्रेशर जब ये ऑक्सीजन माइटोकॉन्ड्रिया में सेल्स में पहुंचती है तो इसका पार्शियल प्रेशर जो है 10 to 20 mmHg होता है। तो इस तरह से जो पार्शियल प्रेशर है वो इंस्पायर्ड ऑक्सीजन और फिर बैरोमेट्रिक प्रेशर और इसके अलावा ऑक्सीजन जो है कंसंट्रेशन, ये तीन चीजें इफेक्ट होती हैं जो फैक्टर्स इफेक्ट करते हैं ऑक्सीजनेशन एट वेरियस लेवल्स इन दी ऑक्सीजन कास्केड। तो पहले जो है इंस्पायर्ड एयर में, फिर उसके बाद बैरोमेट्रिक आर्ट्रियल जो है ना प्रेशर में, और फिर उसके बाद जो फ्रैक्शन है जो ऑक्सीजन कंसंट्रेशन, तो वो डेवलप होता है। उसके बाद अल्वेलर गैस में जो पार्शियल प्रेशर होता है वहाँ पे इफेक्ट होता है, ऑक्सीजन कंजप्शन में वहाँ पे इफेक्ट होता है, फिर अल्वेलर जो है ना वेंटिलेशन में इफेक्ट होता है। तो आर्ट्रियल ब्लड प्रेशर वो इफेक्ट होता है बिकॉज ऑफ द डेड स्पेस एंड वेंटिलेशन इंक्रीज और द शट डिक्रीज। सो सेल्यूलर जो है पार्शियल प्रेशर वो इफेक्ट होता है बिकॉज ऑफ द कार्डियक आउटपुट एंड द कंसंट्रेशन और द वॉल्यूम ऑफ द हीमोग्लोबिन की वजह से। तो इसका मतलब ये है कि टाइप ऑफ हाइपोक्सिया की कितनी एक्साम है हाइपोक्सिया की। एटमॉस्फेरिक हाइपोक्सिया जिसको हम हाइपोक्सिक हाइपोक्सिया बोलते हैं या हाइपोटोनिक हाइपोक्सिया बोलते हैं। तो हाइपोवेंटिलेशन हाइपोक्सिया, हेमिक और हीमोटोजेनस hypoaxia, anemic hypoxia or circulatory hypoxia, stagnant or ischemic hypoxia, or histotoxic or cytotoxic। पहले तो जो जब हाइपोक्सिया होगा तो एयर से शुरू होगा। एयर में अगर कंसंट्रेशन ऑफ ऑक्सीजन लोअर है या पार्शियल प्रेशर of the oxygen is lower or atmospheric pressure is lower, then it will cause the hypotonic hypoxia। जब ये लंग्स से ब्लड की तरफ ट्रांसफर होगी, the binding capacity or the volume of the blood or the hemoglobin level or a concentration is lower, then it will cause hemic hypoxia। When it will go to the tissues, then mostly the oxygen is being carried out by a blood due to a binding, and that will cause the circulatory hypoxia. When the oxygen is not properly consumed by the tissues, then it will cause histogenous hypoxia. So mostly hypotonic hypoxia is characterized by the decrease of partial pressure of the arterial partial pressure or the atmospheric partial pressure below than 60 mmHg. So also causes a hypoxia, hypoxic hypoxia. So mostly it should be a 150 mmHg atmospheric oxygen partial pressure, but if it is below than 60, then it will be cause the hypoxia. Mostly the etiology is the decreased oxygen level of a inspired air। एयर में जो ऑक्सीजन लेवल 21% होती है वो 21% ना हो, हाइपोवेंटिलेशन हो, जब वेंटिलेशन प्रॉपर नहीं हो, सफोकेशन हो, that may have to lead towards the hypoxia। डिफ्यूजन एब्नॉर्मलिटी हो और वीनस टू आर्ट्रियल शंट जो है जिसे टेट्रोलॉजी ऑफ फैलेट भी बोलते हैं, जो that may have caused this the hypoxia। तो मोस्टली अब अगर आप देखें कि अगर हाई एल्टीट्यूड पे चले जाते हो तो that will affect the atmospheric pressure, and on a zero altitude the atmospheric pressure of a oxygen is 158। that will cause the arterial pressure 100%, 100 mmHg, which has to cause result in 95% oxygen saturation। When the person is climbing on the high altitude, then the partial pressure will be reduced after 3 kilometers altitude. That will be 110 mmHg of a oxygen partial pressure in the air, whereas when it reaches to the arteries, the arterial partial pressure of the oxygen will be reduced to a 62 mmHg, whereas it is required 100 mmHg. So it will reduce the saturation of the oxygen at a tissue level. So that will be a 90% of the oxygen percentage. Whereas if the person goes up to a 5 kilometers altitude, definitely the air oxygen level will be reduced by 85% mmHg, and the partial pressure in the arteries, it will be at 45 mmHg, and then the percentage of saturation of tissues will be reduced up to 75%. Whereas if the person goes up to 8 kilometers, then there will be a 58 mmHg partial pressure in the air, and the oxygen in the arteries will produce the 30%, 30 mmHg partial pressure, which will develop 58% saturation of the oxygen in the tissues. That may have to lead the death of the person. Therefore, mostly the climbers which go into a high altitude, they carry the oxygen cylinder so that they may have equip themselves and to prevent themselves from deadly risk, so that they have an oxygen at a high altitude. So venous to arterial shunt, whenever there is a the septum, defective septum, that has to cause and allow the unsaturated or the non-saturated oxygen, non-saturated will go into the saturated area that, without going through a pulmonary artery or pulmonary vein to the other right septum or a right article. So this will cause, definitely this shunt from right to left will cause the suffocation, will cause the hypoxia. Hemic hypoxia refers to a decreased quantity of a hemoglobin in the blood or altered affinity of a hemoglobin for oxygenation. अगर hemoglobin कम हो तब भी, या hemoglobin की बाइंडिंग कैपेसिटी जो है, कैरिंग कैपेसिटी जो है ऑक्सीजन की, वो रिड्यूस हो जाए, so that it will cause a hematogenous or a isotonic hypoxia. And mostly this is the mechanism depends on the quantity of hemoglobin. If it is changed to anemia, it will cause the hemic hypoxia. Quality of the hemoglobin. If the hemoglobin having a less carrying capacity or a binding capacity to the oxygen due to a carbon monoxide, means carbon monoxide may have caused the poisoning that has to carboxyhemoglobin, and the poisoning, serious poisoning, due to the presence of the nitrite that may have caused a methemoglobin, uh, uh, that is serious poisoning that may have to lead towards the hypoxia, hemic hypoxia. Carbon monoxide poisoning may be due to the 1 to 3 1 to less 2, 3 DGP, or it may have to reduce the oxygen to release. So therefore, it have a reduced affinity or binding capacity of the oxygen. Methemoglobinemia may have to develop due to a ferrous instead of iron, and the hemoglobin may reoxidized to a ferric state, and under this action of a oxidizer in the presence of a nitrite or a nitrobenzene that may have caused the hemoglobin ferrous losses the ability to carry the oxygen. So this may have caused the ferrous poisoning that has that reduces the affinity or a carrying capacity or a binding capacity of the oxygen. Circulatory hypoxia. The circulatory hypoxia refers to inadequate blood flow leading to inadequate oxygenation of the tissues, also called hypokinetic hypoxia. This having etiology and mechanism is that may have a systematic circulation obstacle due to a shock, local circulation obstacles due to a left heart failure, thrombosis, arterial stenosis are narrowing. So tissue congestion may develop and causes a tissue ischemia, and therefore the hypoxia develops. Exogenous hypoxia, even though the amount of oxygen delivered to a tissue is adequate, the tissue cells cannot make use of the oxygen supplied to them, and also known as diazo-oxidative hypoxia. And this heterogeneous hypoxia may be due to a mitochondrial injury, cyanide poisoning, arsenide, radiation, bacterial toxins, oxygen-free radical, or inhibits the function of the mitochondria. So deficiency of B group vitamins like B2 or PP, coenzymes required for oxidative phosphorylation that has to lead towards estrogenic hypoxia. The changes of a blood oxygen parameters in the different types of a hypoxia. Mostly in the hypotonic hypoxia, the partial pressure in the air is reduced. The carrying capacity, the maximum carrying capacity of the oxygen remain normal. The carrying capacity of the oxygen in the arteries go to a below the normal, whereas saturation also decreases in the tissues, and the ratio between the artery and venous is also reduced in the hypotonic hypoxia. The hemic hypoxia having a normal partial pressure of the oxygen in the air to the lungs, where the carrying capacity of the oxygen is reduced, and therefore this leads towards a capacity in the arterial blood. The oxygen partial pressure is reduced, and the saturation will remain normal, but the ratio between the arterial and the venous will be reduced, so that the circulatory hypoxia having a normal partial pressure in the air, normal maximum carrying capacity of the oxygen, normal partial pressure in the arteries, and the saturation is a normal, but the ratio in between the arterial and the venous that increases. The heterogeneous hypoxia will cause the partial pressure in the air will be normal. The carrying capacity of the oxygen is at normal. The partial pressure in the arteries of the oxygen is a normal, where the saturation of the oxygen is a normal, but the arterial and the venous ratio of the oxygen is reduced in the heterogeneous hypoxia. So the parameters for the evaluation of a hypoxia, the partial pressure of a oxygen in the air, the oxygen binding capacity, maximum oxygen binding capacity, the blood oxygen content, the saturation of the oxygen, and the difference in arteriovenous oxygen. That these are the parameters on which we can evaluate the type of the hypoxia. The partial pressure of the oxygen and the tension produced by the oxygen molecules physically dissolved in the plasma the normal partial pressure is 80 to 110 mmHg and 100 mmHg 13.3 the kPa. So the partial pressure of the oxygen in the venous will be 37 to 40 mmHg. So total is a 40 mmHg, and the 5.32 is the kPa, and 1 kPa is equal to a 7.5 mmHg. The factors affecting the partial pressure of the oxygen, the fraction percentage of the inspired oxygen, the fraction percentage of inspired oxygen is 21%, that is 0.21. So the pulmonary function, the ventilation function problem, obstructive of the airway and exchange deficient problem, and the edema in the lungs or venous to arterial shunt may affect the partial pressure of